Today we'll speak about injuries of upper extremities. And first of all, you must know the difference between dislocation or luxation and bone fracture. It's a big difference. So joint dislocation occurs when is a abnormal separation is a normal in the joint where two or more bones meet occurs the separation, and the partial dislocation is a subluxation. Good example of subluxation is a subluxation of shoulder after fracture of proximal part of a humerus because of hypertrophy of deltoid muscle. Dislocations are often caused by sudden trauma, but sometimes it can be a result of infection or fall. Dislocation can cause damage to the surrounding ligaments, tendons, muscles, nerves, and first of all to the joint capsule. Dislocation could be in all types of joints, big and small, and the most common is a shoulder dislocation. And bone fracture is a condition where the partial or complete break of bone continuity occurs. So in severe cases, this breakage could be in several pieces. This type of fracture called multifragmentary. Main cause of it is a trauma, force impaction, but sometimes less impaction could lead to fracture in case when patient has osteoporosis, osteopenia, for example, cancer. In these cases, you could see pathologic fractures. And so it also could be, and these fractures are much more severe than common. So every fracture could lead to different complications, systemic and local, early and late. So immediate problems that could lead every fracture is hypovolemic shock. For example, if we have a fracture of a femur, this fracture is equal to 1 liter of blood loss. So if you have 2 femurs fracture, you could see, you know that it's a severe hypovolemic shock, like 3rd stage. So actually, it also could lead to acute respiratory distress syndrome of adults, fat embolism, thrombosis, pulmonary syndrome, septic traumatic fever. It also could be in case when you have fracture, and also could be when you treated it surgically. Septic complications in case of open fracture, because open fractures are always primary infected, and crush syndrome. And late complications, delayed union, non-union, malunion, and cross union. So you must know there is a normal terms of union, consolidation, yes? So if you have less than 2 terms of normal union, it's delayed union. If you have 2 and more terms of this union, it's called like non-union or pseudoarthritis, pseudoarthrosis. So actually, fractures could lead to injury of vessels, muscle, joints, and other organs, and sometimes it could lead to compartment syndrome. There are some specific complications. It could be just in some specific areas. For example, avascular necrosis could be in case of fracture of humeral head or femoral head, shortening of extremity. Intra-articular fractures often lead to joint stiffness, fracture that is close to nerves could lead to SADX dystrophy. Open fractures could lead to osteomyelitis, it's often problem. Ischemic contracture is a result of compartment syndrome. Myositis ossificans, it could be as a result of abnormal mineral response. And osteoarthritis post-traumatic is normal in case when you have interarticular fracture. So you must know first of all the main classification of fractures is AO, Association of Osteosynthesis. So this classification is very good for clinicians, and every fracture is classified, and you know the key how to treat every fracture. Because actually there is A, B, and C types of fracture. A are simplest, C is the severest fractures. So first of all, when we speak about upper extremity, we must speak about scapula. Scapular fractures are not very widespread. It could be combined with chest injuries, and is also is very often is a result of polytrauma, for example. There are a lot of types, 7 types of scapular fractures, but main thing is a fracture of glenoid articular surface of scapula. So you must know a rule, one big rule, then when you have intra-articular fracture with dislocation of bone fragments more than 2 millimeters in this, so this fracture should be treated surgically. But when we speak about scapula, it's very rare when you have a fracture of glenoid. So it's not very common. It's much more often when you have a fracture of a humerus. There are different ways of treatment of it, but main thing is a bandage. Bandage is a very common bandage for upper extremity. And almost in every case, even with big dislocation, scapula could be united without operation and with good functional result. Clavicle fractures. They are very widespread, account to 10 to 15% of total number of all fractures. So you should know that almost these fractures must be treated surgically. Also, when you have a fracture of humerus, it's called like a floating shoulder. So fracture of the humerus. More common are fractures of the proximal metaepiphysis. These fractures are common for elderly people, and you should know the difference between anatomical, surgical neck of it, Greatertuberosity fracture, and lesser tuberosity fracture. Almost it's very widespread that Greatertuberosity fracture occurs. There are different types of this fracture, but you must know a rule that it's very common for elder people, firstly, and every metaepiphysal fracture has a good possibility for healing without any operation with not bad functional result. Even if patient wants to have better functional result, you could provide surgery, because after surgery, patient could start working with its range of motion immediately without any immobilization period. But if patient could not proceed to operation by different cases, because of different cases, you could also heal it with distal bandage, for example. Distal bandage, wedge-shaped pillow, plastic cast. Plastic cast are useless nowadays. Distal or wedge-shaped. Wedge-shaped is great in case when you have Greatertuberosity fracture. On this picture, you can see different types of synthesis. When we speak about metaepiphysal fractures, optimal way of treatment is plating. Plate and screws. In case when you have multifragmentary fracture, for example, it has 3 or more parts of head, it's better to provide plasty. And diaphyseal fractures of humerus. One trick, diaphyseal fractures heals much less better than metaepiphysal, and it needs much more term to be united. But golden standard of treatment of diaphyseal fractures of humerus is conservative, with functional bandage, for example, like this. On this picture, you could see 3 main different ways of treatment of this fracture. It's nailing, plating, and extrafocal osteosynthesis with rods. But you must know that plating you could use for almost every fracture. Extrafocal is better for open fractures and also in cases when patient has different contraindications and open fracture and maybe in case of polytrauma, because extrafocal is very fast type of synthesis. And nailing. Nailing is less it leads to much less injury for patient, but you need an X-ray, C-arc for nailing, and you must have a skill. But actually, it's a great way for diaphyseal fractures, only for diaphyseal types of fracture, first of all. When we speak about fractures of the distal humerus, you must know that elbow, yes, the joint has one thing, that its injury of this area lead to joint stiffness of elbow very fast. So this joint is could be affected by contracture very fastly. So almost in every case when we have fractures of distal humerus, intra-articular fracture of this joint, and proximal forearm, it's better to provide surgery, even in case when you have no any dislocation. It could be very useful for this case. These types of fracture are very severe, and the chance of joint stiffness also very high. But without operation, it will lead to ankylosis. It's a case when you have, it's a condition when you have no any function. Contracture is decreasing, severe decreasing of range of motion. So when you have a, for example, fracture of distal part, it's in case when patient don't want to provide surgery, it's better to provide functional orthosis. You could provide function even from the 3rd day after trauma. And there are, on this picture, you could see different types of this fracture and different ways of its treatment. Fractures of the proximal epiphysis of the forearm. Very common is a fracture of the ulnar process. It's common intra-articular fracture that must be treated surgically because to this process fixes musculus triceps brachii, and it leads to secondary dislocation of bone fragments. So it's much better to provide surgery here. Fracture of the deficit of the forearm. It's also common, but you must know that there is two very serious injuries. It's Monteggia and Galeazzi fracture. In the first case, you have the luxation of a radial head and a fracture of ulna, and the opposite, yes, fracture of radius and luxation of ulnar head. It could be as a result of a force, maybe with some direct impaction on ulna or radius. For sure, it must be treated surgically. You must provide surgical plating and reduce the luxation. On this picture, you could see the extrafocal type of osteosynthesis with Elizaro's apparatus. It's very good for all types of fracture, but it needs special knowledge for it. It's not very simple for providing, but it could be useful for every type of fracture. And the fractures of the distal epimetaphysis of forearm. Main thing here is the radial radius. So it's the most common fracture in traumatology, and almost in every case you will have two-part trauma, two-part fracture. These fractures are called like Colles and Smith. Even with dislocation, these fractures could be treated without operation very well by closed reduction and plastic cast. But when you have intra-articular fracture with 3 or more parts, it's much better to provide surgery, plating or extrafocal osteosynthesis. Like this. It's plates for it and extrafocal osteosynthesis. And when we speak about wrist, main thing is to know the scaphoid bone fracture. In case of fracture of it, you will have one problem, that one part will lose its blood supply. So almost every fracture of scaphoid with dislocation of bone fragments must be treated surgically with Gerbert's screw, for example, or other compression screw. And in case of there is no dislocation of it, you could provide very long-term immobilization, up to 3 months. And about dislocations. First of all, we must know about clavicle. It's a rupture of acromioclavicular ligament. And in this case, you could see also rupture of coracoclavicular ligament. It's type 3 of this dislocation. It must be treated surgically by tie roping of this rupture to reduce it. When you have just rupture of this and with any significant dislocation, it could be treated without any surgery. And when we speak about shoulder, if you have a patient with shoulder dislocation, it's really very simple to see it, but you must provide X-ray before your reduction, because sometimes you could have dislocation with combination with fracture of it. So when you reduce this fracture, you could see that you haven't done any fracture, yes, to make your life well. So you must provide first X-ray, even in case when you are sure that this is a dislocation of shoulder. And a dislocation of forearm is also very common, but it's very simple to reduce. And sometimes you must take a look at coronoid process. It's very often that traumatologists can't take a look at coronoid process. And if you have a fracture of it, this dislocation is unstable, so it could lead to secondary dislocation. So it must be treated surgically. Okay, so it's all for today. I hope it was useful for you.